Hello and welcome to The Explainer. Today, we're going on an incredible journey. We're going to follow a single, tiny pill on its complex mission through the human body. It's a trip that has checkpoints, a few roadblocks, and a very specific final destination. So let's trace its path. I mean, it seems so simple, doesn't it? You take a pill, maybe with a glass of water, and a little while later, you start to feel better. But what's really going on in between? Well, it's a fascinating, microscopic mission happening inside you right now. This entire process is the science of pharmacology. And you can think of it as a two-way street. There's what the drug does to the body, we call that pharmacodynamics, and then there's what the body does back to the drug, which is pharmacokinetics. Today, we're going to focus on that second part, following our one little drug on its amazing adventure. Okay, so every mission needs a starting point. For our drug, this is called administration. And it's not just about getting the medicine into your body. The route it takes, how it crosses that initial border, is the first, absolutely critical decision that shapes its entire journey. So, what you're looking at here is a classic trade-off. Taking a pill is super easy, super convenient, but it's also the scenic route. That drug has to survive the harsh acid of your stomach just to have a chance of being absorbed. An IV injection, on the other hand, that's the express lane. It's 100% bioavailability, meaning every single molecule gets straight into the bloodstream. It's the fastest way to get an effect, but it's obviously more invasive and carries some higher risks. And here's the bottom line. No matter how it gets in, whether it's a pill, an injection, or even a patch on your skin, the drug's first major job is to get into the body's main highway system, the bloodstream. This step is called absorption. And without it, the drug is basically useless.
All right, our drug made it. It's in the blood. It's officially on the grand tour. But, the body is a huge place with trillions of cells. So how in the world does the drug know where to get off?
This brings us to the next phase of the journey, which is called distribution. I want you to think of the bloodstream as this massive, complex delivery service, shipping packages all over the body. But, of course, not every package is meant for every address. Scientists actually measure this with a cool concept called the volume of distribution, or VD for short. A drug with a low VD, well, it's kind of a homebody. It likes to hang out mostly in the blood. But a drug with a high VD is a real explorer. It leaves the bloodstream and travels way out into the body's tissues, like fat or muscle. And knowing this is absolutely key to figuring out the right dose. Now, here's a complication that makes this whole distribution thing tricky. A lot of our little drug molecules can't just get off at their stop right away. Why? Because they get picked up by these big proteins floating around in the blood. While they're bound to these proteins, they're completely inactive. They're just along for the ride. It's only the free drug molecules, the ones that are unbound, that can actually hop out of the bloodstream and get to work. The thing is, your body is incredibly smart. It doesn't just let foreign chemicals hang around indefinitely. It has this really sophisticated two-part system for breaking them down and then showing them the door. This whole process is called Biotransformation, or more simply, metabolism. And the main chemical processing plant for this is the liver. In phase 1, this family of enzymes called cytochrome P450 basically modifies the drug, maybe adds a little chemical handle. Then, in phase 2, the body attaches another molecule to that handle. This is the crucial step that tags the drug for disposal by making it water-soluble. So, after the liver's cleanup crew has done its job, those newly water-soluble drug molecules get carried by the blood over to the kidneys. The kidneys then act as this amazing filter, pulling the transformed drugs out of the blood and sending them on their final exit route, out of the body through urine. Okay, so far we've talked all about the journey to the target. But what happens when the drug finally arrives? Well, this is the main event. This is how a drug actually works its magic. This is the moment of truth. Most drugs do their job by finding and binding to very specific molecules called receptors, which are often on the surface of our cells. The drug is the key, and the receptor is the lock. When that right key fits into the right lock, it turns, and that single action triggers a change inside the cell, which produces the effect we're looking for. Now, here are two words that people mix up all the time: potency and efficacy. Let's clear this up. Potency is all about the amount of drug you need. A more potent drug just means you need a smaller dose to get an effect. Efficacy, on the other hand, is about the drug's maximum power. It's the biggest possible effect a drug can produce, no matter how much of it you take. And this is so important to understand. Just because a drug is more potent doesn't mean it's better or more effective. You might only need a tiny, tiny dose of it, but maybe it only produces a very mild effect. The real goal is to find the drug with the right efficacy for what you're trying to treat. So the drug's journey isn't always this perfect straight line from A to B. Sometimes things get complicated. There can be unexpected detours, and that's what we experience as side effects or drug interactions. An adverse reaction, or a side effect, can happen if our drug key is a bit of a skeleton key, meaning it accidentally fits into other locks or receptors that it wasn't supposed to, causing effects we didn't want. A drug interaction happens when two different drugs get in each other's way, often by messing with that metabolism process back in the liver. And get this, it's not just other prescription drugs you have to worry about. Even common foods or supplements can totally throw a wrench in the works. In fact, one of the most famous examples of this might be sitting in your kitchen right now. And this table perfectly illustrates what we're talking about. Remember that P450 cleanup crew in the liver? Well, grapefruit juice literally blocks one of the most important enzymes. So if you're taking a statin drug, your body can't clean it up as fast, and the levels can build up to a dangerous point. St. John's wort does the exact opposite. It speeds up the enzyme, which can clear out a drug like an oral contraceptive way too quickly, making it much less effective. So there you have it. From a simple swallow to a complex biochemical odyssey, the journey of a drug is just an incredible process. And hopefully understanding these steps, absorption, distribution, metabolism, and excretion, helps demystify how our medicines actually work, and maybe it empowers you to ask better questions. Thanks for watching.